So I'm just going to introduce my presentation a wee bit. So it's patient presentation in elective orthopedics. So the aims of this presentation is to introduce the THR, so the total hip replacement and the total knee replacement patient presentation videos, to discuss the reasoning behind their development and to discuss the larger plans moving forward with regards to how we interact with our elective patients pre-operatively and post-operatively. So why now? So pre-COVID, we used to have approximately 30 patients every fortnight who were due to have a total hip and a total knee replacement come into our MSK outpatient department for a pre-operative talk about what to expect during surgery and their recovery post-surgery. So during the first wave of the pandemic, our elective orthopedic services were suspended, and this really gave us time to look at how we interact with our patients and prepare for change that we all knew was coming. So why was this important? So as part of Get It Right First Time, especially in orthopedics, they look at 3 areas which we should all have standardized approaches to across the NHS. So we look at pre-operatively, intraoperatively and post-operatively, and also an enhanced recovery pathway. So some of the main reasons that we look at this is to reduce the length of stay, improve patient outcomes, standardized care, and improve patient shared decision-making processes. So our new pre-operative videos obviously look at the pre-operative processes in this. So when we evaluated our process, we found that it took 2 therapy staff to come off the wards every fortnight for about 2.5 hours in order to organise the area, to get the chairs out, all the technology equipment ready, so that we could be ready for our patients when they arrived. It also took 1 therapy staff member on any designated day in order to book the patients in on our booking patient appointment system. And we used to post our invitations to the patient, and then we used to call them in order to confirm they're attending the class. We also used to have to book space, which took away vital space from the MSK outpatient rehabilitation department. We'd also have to get transport books for patients who couldn't come into hospital independently. And we used to use a lot of print. There was a lot of paperwork involved in all of this. So what we then looked at, we had 6 areas to change. So clinical staff being removed from wards, we wanted to reduce that. Unable to have so many patients in one area at one time due to COVID. Using other teams' resources, such as the MSK outpatient department. Reducing the cost of paperwork, hospital transport, and reducing the cost of sending patients invites individually. So then we looked at how can we meet the needs of our patients, pre-operatively. So we knew that with COVID-19 that our pre-operative process had to change because we would never be allowed within the next, say, 1 to 2 years to have that many patients in one area at one time. We therefore looked at how we can reach most of our elective THR and TKR patient group effectively, and we came up with the idea of patient presentation videos. Okay, so what the patient presentations have achieved is we no longer require therapy staff to leave the wards fortnightly. We no longer use other team space for classes. We can reduce the need for patients to attend hospital pre-operatively. We've reduced the cost from hospital transport, from paper invites, and the cost of postage. We no longer spend time individually booking patients to come into these classes, and patients have access to the presentation at any time, and they can refer back to them at any point. So also we're able to engage with our patients pre-operatively, ensuring that they can make an informed decision and are able to prepare themselves for elective surgery. We also, you might have seen, we have subtitles, so that assists with us being able to reach any patients that are hard of hearing or have hearing difficulties. we're also looking at having these subtitles translated into languages that are commonly spoken by our patients in our catchment areas. We're able to reach more patients with fewer resources, and these changes have galvanised our therapy orthopaedics team to make further changes within our patient pathways. So moving forward, what we hope is that we have a sustainable orthopaedic website, which will include patient presentations on all our regularly seen operations. So we currently have presentations ready to be filmed, include the fractured neck of femur patients for our families and next of kin, shoulder surgeries, ACL repairs, and I think we're also looking at the other knee and commonly seen foot surgeries that we do. If a patient doesn't have a computer, what we have done is designed a patient information booklet or leaflet, which can either be sent to them via email, or if they don't have access to a computer, we can send a paper version of that copy out and it's given to them in pre-assessment. So that's my presentation. Thank you for watching. If you have any questions, please just let me know.